for me really to build this advanced care planning inclusive concept. And that would mean that if we develop new interventions or approaches, we need to focus on how can we maximize capacity. If we build a new intervention, actually, how can you do that maximize capacity? Because that means the setting, but also the timing, the flexibility. It's more messy, I agree. It's not an easy, I do 3 conversations and I see the output. It's more messy, but I really think we should do that, maximize capacity. Think about how to involve and support family. So that means the partner. Usually we talk about the representative, but there's a lot of other people standing around the person with dementia. And so find ways to support these conversations outside of the professional context also. When we build new interventions, for me, we should really prevent the pitfalls. So the one-off scripted end-of-life conversations or tick boxes without seeing those as an opportunity to discuss and inform and communicate, but focus more on what matters to people and aim to implement that in a broader holistic approach. And then finally, when we do research, for me, it's really important to include people themselves. So user-centered design, for example, when you develop a new tool, I think is really the way to go with people with dementia, and they really want us to do that. And then lastly, when we do these outcome measures to see whether it works or not, really trying to see them as different elements in that process. So it doesn't always have to be the end product for everyone. So if we say, for example, we want to give people the opportunity to talk about advanced care planning, well, giving them the idea that they have had the opportunity is also a good outcome, I think. So this is some of the work we are doing currently in Belgium. We're developing these tools together with people with dementia and their family. For example, on the right is a website that we're making, really focused on this broad approach. I'm sorry, it's in Dutch, but it says it's a tool to see what's important to you now and in the future in general. What are your values, basically, and what you would like in terms of your future care and treatments. And care, very broad, not only specific elements related to medical care. And as part of that website, we've also been translating the Go Wish cards. I don't know if you know the Go Wish cards, but they have been developed originally in the States, and a lot of Swedish researchers have also done some studies with it. They give really good results. It's a deck of cards, and it gives you quotes on what's important to you. And you have a way of playing with these cards alone or together with family. And it sets off a lot of interesting discussions. It's not about which card people choose. It's mainly the reasoning on why they choose a certain card. I don't want to be in pain, for example. Or for me, God is important. Or for me, dying at home is important. So the conversations behind that are triggering that are triggered by these cards, those are the most interesting to support, I think, conversations outside of this professional context. So the public health approach, this might fit there.